I was meeting with a colleague that I had done some work with in the community, and we talked about this thing that was happening in the world of pediatric physical therapy called Go Baby Go. And we talked about it being a possibility and could we make it happen. And I made a random phone call to Cole Galloway, the founder of Go Baby Go, and said, I think I might like to do this. And that phone call happened in February, and in May we had our first build, and we are now have provided cars for 135 children in our community. We've had 400 kids building for other kids. We have a Nights on the Go cafe, and we hold inclusive play dates around our community. I am Jennifer Tucker. I am a clinical assistant professor in the Doctor of Physical Therapy program. I'm also a board certified pediatric specialist in pediatric physical therapy, and I am the director of UCF Go Baby Go. So what I love about the Go Baby Go movement is that it really is about things that are innovative and accessible and affordable. And so it's, as you look behind me, the cars that are behind me are cars that all kids drive. They're, Fisher-Price Power Wheels. They're just battery operated ride-on cars that you see little kids driving around in the neighborhood. What we put on them is PVC pipe that you can get at Home Depot and Lowe's, and we use pool noodles to cushion them, and we use industrial strength Velcro. And so something like this that's a pool noodle that allows a child to float or have fun in the pool becomes a supportive device on a car. What I think is so powerful about that as we move out into the community is it demonstrates for people the solutions for providing access and participation. They don't have to be sophisticated. They don't have to be super technical. They just need to be accessible. And anybody can go to Home Depot and buy a bunch of PVC pipe. Anybody can go find pool noodles. They're $1 at the dollar store. And put those together in a way that's novel that allows a child to have access. So that has really opened the doors. We have Kids Building for Kids workshops, and we go in and let 3rd, 4th, and 5th graders, they can put together pool noodles. They can drill through through PVC pipe. They can cut and measure Velcro, and that empowers them to see you're a part of the solution. And we can, as a community, meet a need with what we have readily available. So I think it's much more empowering for all of us to know that it's not anything, it's a pool noodle, and to look at a pool noodle differently. It's a PVC pipe. The solution's in front of us. It's just, can we be creative and work together to find that solution to really broaden our community and make it more accepting of people of all abilities. So I think one of the misconceptions about Go Baby Go is that it is just about the ride-on cars. And the ride-on cars are amazing, and we love that work, but it is as important for us. We're not just taking care of babies. There are individuals with mobility impairments across the lifespan. So our harness programs allow us to provide novel opportunities for gait or walking for those individuals that might not otherwise have that opportunity. So in looking at some of those early days and those early discussions about Go Baby Go, one of the things that we became really intrigued by was this concept of, could we create an opportunity to have a cafe in our atrium where I teach in the College of Health Professions and Sciences. It seems so natural that if we were going to have a harness cafe, that we would put it downstairs in our building. And what the cafe does is it provides an enriched environment for adults who are survivors of stroke and traumatic brain injury to come in and practice those skills they've been working on in rehabilitation. So they come in and they're in a safe environment where they can practice mobility. Their hands are free to move and go and grab and get items. They get to have conversations. And for many of those stroke survivors and those traumatic brain injury survivors, they've exhausted all traditional avenues of rehabilitation, but they're not at the finish line. The goal hasn't been met. So this cafe provides a place where they get to practice all of those skills in a real world environment. They get to be the teachers of all of those health profession students. We have social work students coming up and getting a Coke. But getting a Coke from somebody who's a stroke survivor and having a conversation is a much more meaningful interaction than grabbing one out of the machine down the hall. So that experience has been, I think, extremely rewarding for everybody. I think it's been rewarding for our stroke survivors because they're excited. They're a part of community. They get to come be a part of the UCF community and interact with our students and interact with our faculty and be a part of something bigger. And then I think for our students, they get an opportunity to see healthcare through a different lens. healthcare doesn't just take place in a traditional environment. We need to take those opportunities out into the community so that people can live their very best lives and reach their potential.